the next part of this video, I think, would be really helpful to talk about the exam itself, the most important exam, the NZREX exam. I know just bound by contract, you're not allowed to talk about the specifics of the exam, but I appreciate, and I'm sure the viewers will appreciate, just a general sense of the structure of what to expect, and as much as you're allowed to talk about it, if that's okay.
So NZREX exam is exactly as it is mentioned in the clinical handbook that we have on the website. So I would say if you really want to know more about exam, just go through that clinical handbook as many times as you can. Just absorb it 100% because that's exactly how the exam is designed. It's an OSCE exam, which tests your clinical knowledge. They don't really want to know about your theoretical knowledge. So when you say clinical knowledge, they want to see how you're incorporating your skill or your knowledge that you have in your patients. One of the most important things I found is good communication. Even if you score 100 out of 100 marks in your theoretical exam, but if you can't communicate your knowledge to your patient, you are a fail. And I think that's what they are looking for. So even if you make a mistake and you acknowledge that you have made a mistake, or at the end of the station, even if you say, I think I missed this, they will acknowledge that, because in real life, it's very normal that you can forget asking someone like their social history, or let's say whether they were a smoker or not in a case of COPD. But as far as you know what mistake you have made, and as far as you acknowledge this, I think they're very reasonable about the exam.
Do you know what's the pass rate for this exam?
I think it's 60%.
And so then I guess would you say that actually the exam itself isn't the hardest part, it's the job finding?
Yes.
That is the most difficult out of this whole process.
Yes, definitely. Because you've done all the hardest part when you're sitting in the examination room. Hardest part, one, after the exam is finding the job. Number two, before the exam is passing the prerequisite. So if you're sitting in the examination hall, you just have to think before the exam that you have done most of the thing. It's just the last work that you need to take. And all of my friends or everyone who took the exam was telling me. So I would tell the same thing to everyone. If you are sitting in the examination hall, your chances of becoming a doctor in New Zealand are much more higher than anyone else. You know what I mean? So it really helps to boost the confidence, saying that the exam is not the hardest part.
And it sounds like you had a good group of friends supporting you through this process. Would you recommend if there are any resources that you're allowed to share, or any groups that people can join in order to best prepare themselves for this exam?
So definitely everyone should be active in the Facebook group. Just type NZREX on search bottom in Facebook, and then whatever comes up, just join everything. And then in 1 or 2 weeks' time, you will find out which are the active groups and which are not. There are messenger chats with the same group linked. So same, in 1 or 2 weeks' time, you will find out which are the active groups and which are not. You can also look into Telegram, but I wasn't really successful because there's not much support in Telegram. But for other exams like PLEB, there is a lot of Telegram support, but we don't have that for NZREX. Joining the groups helps you because there are people who have taken the exams, there are people who are taking exams, and there are people who will take the exam. So you have exposure to all kind of people, but be careful that you don't trust everything that's said there, because some people will be extremely negative. So that's what I have learned. And my partner used to always tell me that just ignore the negative part, but I didn't trust him. But now at this stage, I think he was right. Like, ignore the negative part of it. Because when I joined the group, let's say 5 years ago back home, it seemed to me that this is an impossible pathway and it's very vague. I mean, I used to think all the negative things about this pathway. But when I actually did it, I realized that if you're hardworking, if you're proactive, and if you're knowledgeable enough, and what I mean by knowledgeable enough is you don't have to be a top ranker in your school. I wasn't one. I wasn't in the bottom, I wasn't in the top as well. So I was somewhere in middle. So
Mm.
that's generally where you are. And if you are confident enough, this is a doable pathway.
Oh, that's actually really, really refreshing to hear. Because you're right, like I don't think there's much positivity around the pathway to get into New Zealand as an AMG. A lot of the comments that I'm getting is that, oh, there's like no resources out there. Everyone says it's too hard. But it's
Yeah.
refreshing to hear that it's very doable.
Yes, exactly. Because if someone's reading at the group or reading the comments in the group, I would say if you're back at your home and not in New Zealand, it's very easy to convince yourself that, okay, let's just choose another country or let's just switch to an alternative one. But that's not really the case.
Okay. Would you recommend any other resources that you're allowed to share
Yes.
to prepare for the
So
exam?
for physical examination, I get around 4 physical examination sessions, and there could be a mix of history and physical exam or just individual physical exam stations. So Geeky Medics is a very good resource, and that's what I found in groups as well. People think that Geeky Medics is a very good resource. So I would say practice all of your common stations. Geeky Medics is short, precise, and very accurate tools to practice your examination. Like I used to always practice with my husband, and I practiced each and every system. So you start with head until the toe, whatever you could think of. Practice all the examinations like cardiorespiratory, neurology, upper limbs, lower limbs, and everything. And you have to be that thorough that even if someone wakes you up at night and tells you, can you perform a cardiorespiratory exam on me? It should be spot on. So that's the level of preparation you need. It's really basic. Like a doctor who goes into the hospital and works as a doctor should know that. And I agree with it. As far as most important things are covered, you will pass the stations.
Perfect. Okay. And as well as acknowledging anything you miss at the very end, like you said.
Yes. Yeah, it's completely normal. Like on my neurology exam, I don't know if I passed that station or not, but on my neurology exam, I almost forgot to check the tone of the patient, like in a neurology exam with positive neurological symptoms. But yeah, at least you know what you've missed. And at least if you just say, if I had more time, I would have done more assessment on the tone of the patient.
That's really reassuring.
And for the history, I would say just be systematic in your approach. For example, we all know that we have some mnemonics for history, like for any pain, we follow Socrates or Odipera. So I would say stick to that because it keeps you organized and you don't miss pertinent history. For example, a patient who comes with a differential diagnosis of pulmonary embolism, it's really important that you ruled out or asked about the risk factor, like whether they were traveling or whether they have contraception use or things like that.
It sounds as though that the NZREX exam is quite a good exam to prepare you to become a doctor, really, because everything that you've said is literally what we do on a day-to-day basis, hey, when we're assessing a new patient or an ongoing patient.
Yes. And I would say what they're looking for is a safe doctor. And this is not something that we are not taught in our home countries. I'm sure when we did an OSCE exam in my home country, that's exactly what they used to tell us. So this is not something that examiners have told me, but this is what I've concluded from my exam and how I prepared myself.
Okay. Thank you for that. You've already mentioned some really good tips, including the timing of approaching recruitment, as well as potentially looking at regional hospitals to apply. I was wondering if you have any other tips in general before we sort of wrap up in terms of anyone who is keen to apply to move to New Zealand as an AMG.
So I think once you have ticked all your boxes and while you're waiting for NZREX exam, I think it takes a quite long time for you to book an exam and get a spot in the exam. For me, it was 1 or 2 years of waiting. So it's best that you utilize that time in alternative careers to make yourself ready for New Zealand health system. I've seen many people working as phlebotomists. I've seen many people working as physician assistants. This is a quite popular role in North Island, but not in South. And it's a very well paid role. I've seen people working as research assistants. I've seen people working as hospital aide. So anything that lets you work in the hospital is beneficial. And the reason is it will help you make some contacts, make some good references, because it's very important that you have a good reference letter to get a job.
Is it necessary to have a reference from New Zealand?
Yes. So when you apply for a job, it says you have to have 3 references. And ideally, this has to be references from New Zealand. But I just told my recruiter that, look, I didn't work into New Zealand. How can I have 3 references realistically from New Zealand? So what I did was I had 1 referee from New Zealand where I worked, and then 2 from my most recent job. So that's also important, like how active you have been as a clinician. So because I worked as a doctor in my home country, I had a very recent and a very good reference letter. But for someone, for example, for a mother who was raising kids, or for a mother who have moved to New Zealand for 5 years and haven't worked at all, I see that it will be really challenging for them to get a good reference letter. So I think it's very important for those people to work in New Zealand before they apply for a job, because this could be one of the major barrier not getting into the role.
That's really good advice. I just wanted to ask, at the end of it, was it worth it to have moved to New Zealand? What are your thoughts?
Yes, definitely. I think it also depends on what your priorities are at the end. So as I said, I moved here to join my husband. If you have family here, you really have to make your way out. And if you really want to work as a doctor and live with your family, then, and once you get into the job, you'll find it's really worth. But there are pros and cons to both the things. Like, it's good money here. I also feel like it's still not well acknowledged in terms of pay, but that's the last thing you would want to complain about. And I think the lifestyle is also very nice in New Zealand. It depends actually person to person. If you're like quiet, peaceful, and not so tedious life, then New Zealand is a very good place. But if you're a party person, if you like crowded cities, fast life, then I would say some other country would be a better option. But regardless, I always miss my home. I always miss India. So it really depends on what your priorities are. But I wouldn't say that you would regret at the end of the day that, oh, why am I working as a doctor in New Zealand? I don't think so. Yeah.
And would you say, because you have worked in India before you moved here, right?
Yeah.
What do you think the job is like compared to India and New Zealand?
I think job is totally different because we are 2 different nations. India is a developing one. New Zealand is a developed one. So you have a lot more resources in New Zealand. So your practice would be very much different than what it is back home. Like back home, you can't order a CT head for everyone who has a fall, even if you want to. But here, your hands are free in terms of resources. So your approach changes. The way you approach a patient totally changes. And it's also more organized. For example, back home, you don't know someone's past medical history. You have to be very intense in the history. You have to be very intense in your clinical judgments. While here, you have a lot of backup around that. You have a national system where you can find history of the patient. You already know what medications they're taking from the system, and you have a good inter-hospital digital system as well. So I guess it becomes a lot easier. But at the same time, I find New Zealand hospitals more busier than what it used to be back home. Maybe because we are short-staffed here and we have a lot of boxes to tick. Maybe we have a lot of admin stuff to do, and that makes it busier here. Like I used to work 24 hours or 36 hours shift back home, but these are not as tiring as 15-hour shift in New Zealand. So
Really?
yeah, so I don't know what the reason is, but I find the job more tiring in New Zealand as compared to India, even though if we work more hours back home.
Okay, that's interesting because that was my next question. Like, did you find that the hours in New Zealand are a lot more reasonable than back home?
I think it's good here. Like it's not worse, but I mean, yeah, like I can work 15 hours, but that 15 hours are like exact 15 hours. While back home, it's not like you're really 100% occupied. While in New Zealand, you're 100% occupied in that 15 hours. You don't have time to take a call from your home or you, anything. Sometimes we struggle finding time for lunch and dinner as well. And in terms of pay, I would say when you earn your money in dollars and you convert it in your own currency, you will think like you're earning a lot. But when you stay in New Zealand, it's almost, let's say back home, we have like middle class person or upper middle class person and someone who is very rich. So the amount of money that you earn here in dollars it will give you a lifestyle of, let's say, an upper middle class person in back home. So if you think back home you can be an upper middle class person or a rich person, if you're happy at home in India or whatever country you are, I don't see a reason you come to New Zealand just for the sake of money, if that makes sense.
Is it because the cost of living here is a lot higher?
Yeah, so what you earn is what you spend. The grocery is expensive, housing is expensive, your daily living is expensive. So even if you earn a lot of money, you will spend the same kind of money in your living. So if you're moving a country because you want to become rich, then that's a no-no. It's not just the money that should be the reason to move.
And I guess at the moment, we're still sort of in the PGY years. Have you looked into salaries of specialists, for example, in New Zealand versus back home in India? Are they quite different? Would that make a difference then, or still the same?
It depends on what your background is. For someone who is coming from a very average middle class family, yes, the salaries here are quite a good option, because if you're working as a doctor in a hospital back home, you would earn a lot less. But if you were working as a private practitioner back home, and if you have your own hospital, and if you have resources to build your own hospital, I think it would be more or less the same. And what's the really good thing about New Zealand that I like is, even if you don't step up as a consultant and you keep growing, they acknowledge your growth and they acknowledge it in terms of your salary as well. While back home, I would say you really have that pressure of stepping up as a consultant because you want to earn more. While here, even if you work as a senior registrar for quite a few years, I think that would be really a reasonable paycheck for you that you can really give yourself some time. There's no rush. And I think the environment in New Zealand is really safe, generally speaking. They are very well supportive and they will acknowledge you at the end of the day if you're a really hardworking person.
That's cool. And I guess in India, maybe not so much like with the words of affirmation from your seniors, would you say?
I don't know. I think it was very well supported for me back home as well. Yeah, I wouldn't compare it, but overall, you won't regret here working as a doctor. Long story short.
Okay, good. I think that's probably the take-home message.
Yeah.
It's still like a really good place to work, and
Yeah.
the process is worth it.
Yes.
Awesome. No, I think that comes to the end of the talk. Thank you so much for your time. And all of this information is going to be really helpful, I'm sure, just because of the lack of information out there. I'm very appreciative of your time and willingness to share as well. Thank you so much.
Thank you.